Hi, it's Dr. Jonathan Brown here, and I'm going to give a talk today about moles and how to check your own skin. Now, at this time of year in the summer, people are outdoors, going to the beach, going to festivals, spending time in the garden. We always say wear factor 50 sunscreen, really cover your skin well. Even on cloudy days, a bit like today, there's still quite high UV around, so check the Bureau of Meteorology website, and that will give you an indicator as to how likely you are to burn and how strong the UV is going to be. Now, I've printed out a little checklist of what you can look for when you're looking at your skin. Now, pick a mole on your body, and I've got an example of a mole is something with pigment in. You can see there's a little mole on my skin there. And with any mole on the skin, there's a little mnemonic that you can use to assess whether you need to have it looked at. Now, it's an ABCDE mnemonic, and A stands for asymmetry. So if you look at the mole on the skin, is it symmetrical in shape, or is it asymmetrical? We like the mole to be symmetrical, so roughly round. B is for border. Is it a regular border or irregular, like this example here? Colour. Ideally, the mole should be one colour throughout, so either very light or very dark, but generally one colour rather than two. Diameter. Should be the size of a tip of a pen. So you can see an example here. My mole here is smaller than the tip of a pen. And I think the most important thing is evolution. Is the mole changing, growing, bleeding, itching? Up to about 40, it's normal to get new moles. In pregnancy, moles can change. There's a few misconceptions and myths about moles as well. A lot of people come in saying they cover up certain moles with with high factor sunscreen, or some people use band-aids to cover moles that they're worried about. Now, most melanomas will appear on a piece of skin where you don't have a mole already. So you've got to make sure you cover everywhere already. Use your high factor sunscreen all the time. Don't go on sunbeds. Never step on a sunbed. They've been shown to increase your risk of melanoma. If there's anything that you're worried about, go and see your GP. A lot of GPs do mole checks. A lot of dermatologists and skin cancer clinics do mole checks. If you've got over 50 moles, it might be worthwhile doing something like mole mapping, where they can take serial photos of the moles and compare them over time. But the most important thing is, if you've got anything that you're concerned about, go and see your GP. We've got cameras we can look at moles with. We've got a thing called a dermatoscope. You can look at the mole underneath the microscope, and it really gives us a good idea of as to whether it's a mole of concern or not.